And joining us now live to help answer some of our questions about the new mask guidance is our chief health editor, Dr. Parthaneni. Dr. Parthaneni, good afternoon.
Afternoon, Alan. How you doing?
I'm good, doctor. So this is some great news, but is there a health risk to easing these mandates?
That's a great question. Here's what we do know, Alan. So the kind of vaccines that we're talking about, Pfizer and Moderna, the mRNA type of vaccines, multiple studies have shown not only we know about symptomatic infections where you have symptoms, but we know that asymptomatic carriage, because what's the real risk, right? Your risk is that now you're not wearing a mask, you're not social distancing. Can you spread this virus and be asymptomatic? Multiple studies have now shown that you can drastically reduce asymptomatic carriage. So to me, the risk is very low, meaning that you can do this safely. So if you're fully vaccinated, you should be able to follow these guidelines safely. But remember, this is not in every setting, like nursing homes, public transportation, healthcare settings, and businesses that require masks. So this is not a panacea, but it's really, again, what we talked about for an entire year. How do we get back to normalcy and live lives? And now we distinguish, there is a difference between being vaccinated and not vaccinated. What I mean is a lot of my patients have said, what's the difference? Seems like I have to do the same thing no matter what. Here's another step in going back. If you're vaccinated, your life is going to be very different while we're living with this COVID-19 world.
You know, Doc, there's a lot of fluctuation between the amount of people who've actually received the vaccine. Do you think that this will actually help with vaccine hesitancy?
100%. I just alluded to that. People think, well, who cares if I'm vaccinated, right? I'm still wearing a mask, and I'm still social distancing. I don't subscribe to that, but that's what the argument that's given. Now, if you're not even worried about, a lot of people feel like they're not at risk or they're never going to get sick, so they're not going to bother with it. But now there's real world evidence to show, now listen, you're going to have decreased asymptomatic transmission, so you don't have to wear a mask and your life can change. So there's meaningful differences now between the folks that are vaccinated and the folks who are unvaccinated. That's going to, I think, prompt a lot of people to say, I want to get vaccinated so I can be part of the normalcy that's existing now. It's going to be a big part of it. The other one, I think, is when Pfizer and hopefully Moderna as well get the full FDA authorization, because they're looking not just for the emergency use. That's going to be the next step also to get vaccine hesitancy to decrease. I think this is going to be a big step in that. And to me, it's a fantastic day. When I read the headlines, I was really elated and excited that the CDC, like we said, has now changed based on the evidence and are doing things to really be able to help people's lives and to move forward.
Yeah, this is some great news. Hey, Dr. Nandi, thank you so much. We really appreciate you seeing you on this Thursday.
My pleasure. Take care.
Thank you, Doc. Now,